Fixed oils are esters of glycerin and fatty acid of high molecular weight or aliphatic long chain. Water alkalides alkali-like. So these are organic bases. Therapeutic alkaloid is morphine. There is an alkaloid which is called cocaine. It is addictive. And there is an alkaloid which is called pyrrolizidine alkaloid, which is poisonous. And we have different other alkaloids like caffeine, nicotine, and emetine. And what is a filtrate? Filtrate is a liquid which is passed through filter and it is called filtrate. So, what are some of the advantages of water? It is cheap, it is easily available, it is non-toxic, non-irritant, it is non-inflammable, it does not catch fire, it has a wide solvent action. It can dissolve a large variety of substance or constituents or components in it. What are disadvantages of water? It dissolves the wide range of substances. Even it dissolves those substances which are not required to be dissolved in water. It helps in the growth of molds and bacteria, and hence a preservative is always required whenever water is used in the preparation of some medicine. So a preservative will be required like parabens, like for example methyl paraben, propyl paraben, benzoates, for example sodium benzoate, benzoic acid, and sorbates. These are the preservatives which would be used in the preparation in which water has been used as a solvent, because water it helps and it facilitates the growth of bacteria. It causes hydrolysis of different substances, which means that different substances they get hydrolyzed. So it is another disadvantage. And large amount of heat it is used to concentrate the product in which water is used as a solvent or menstruant. Alcohol is a solvent of choice for alkalides, alkaloidal salts, glycosides, volatile oils, and resins. They dissolve coloring matter, tannins, and many organic acids and salts. Aluminum matter, gums, waxes, fats, fixed oils, and sugars are insoluble in alcohol. What are some of the advantages of alcohol? No, it does not allow growth of bacteria or mold in it. So we can say alcohol is self-preservative. So there is no need to add any preservative in the preparation in which alcohol is used as a solvent. So what should be the concentration of the alcohol which will be helpful in the preservation? That concentration is 20% alcohol. It is neutral and it is compatible with other products. It does not cause any incompatibility with other ingredients which are present in the preparation. It is non-toxic, does not cause any toxic reaction or toxicity. Even small amount of heat is required for the to concentrate it in the to concentrate the preparations in which alcohol is used as a solvent, and it dissolves only selective compounds, the components or the compounds or active constituents, only the desired constituents whose dissolution or whose dissolution is required by the manufacturer or by the person. What are disadvantages of alcohol? It is costly and some of the alcohols are rarely used. Costly means it is expensive. So when from the manufacturer point of view, when a manufacturer uses alcohol as a solvent in the preparation or the medicine that the company is manufacturing, then it causes an additional cost burden on the manufacturer, and the cost of the product it is increased. So it is alcohol is costly, which in turn makes the product costly as well, and it will cause an extra burden on the manufacturer. Some of the alcohols they are rarely used. Commonly used alcohols are methanol and ethanol. Expression. It is a process of extraction of active constituent from the plant parts without using solvent mainstream, which means it is done mechanically with the help of equipment. For example, extraction of oils from the plant seeds like groundnut seeds, castor seeds, mustard seeds, till seeds, and these are applicable to the process of expression. It is applicable to seeds and fresh leaves. What is infusion? Infusion is used for the extraction of those drugs which are soft in nature, for example, leaves and small stems, roots. In this process, the drug is cut into the small pieces, and menstruum is added. And this is menstruum is added in a apparatus which is called as teapot or infusion top, a pot, and then it is kept there for 15 minutes and with occasional stirring, and then it is filtered off. Coffee pot or teapot is the apparatus which is used for the infusion preparation, and drug is placed at the bottom of the pot. Menstruum is added and it is stirred during this process, and menstruum will penetrate into the soft tissues of plant and it diffuses the active constituents into the menstruum. Very simple, you can take the example of tea. How you prepare tea? You add some tea leaves in the teapot, then you add water, then you boil it for 15 minutes. So all of the active constituents which are present in the tea leaves, they are diffused or they are transferred to the boiling water. And what are the active constituents which are present in the tea leaves? It is caffeine. So this caffeine will be transferred into water, and then the tea is prepared. You can strain it, and you can strain it, and then you can pour it in a cup using a strainer. The damp leaves of the teas, they will left behind on the strainer, that is called mark, and you will get a clear tea in your cup, and which is called which can be used. So caffeine, basically, tea leaves, they contain caffeine, and this caffeine will be transferred to the solution of tea which you have prepared. So it is very much useful for the headaches. So people, they have those who have headaches, they will use tea because it contains caffeine, and they will get rid of the headache, or they will have a soothing effect after having tea. After the specified time, content is strained, mark is not pressed, and filtered. The filtrate is used without dilution. Infusions are of two types: fresh infusion and concentrated infusion. Apparatus, it consists of a covered jar, which means it must have a lid over it which will cover it, and apparatus could be made up of earthenware, stainless steel, ceramic, glass, porcelain, to which is fitted at certain height a perforated tray upon which the crude drug is placed, and then water will be poured on it. So the teapot, it has a perforated tray. Perforated tray means tray having holes, and on this a crude drug will be placed, and then water is poured over it. The plant is enclosed loosely in small, or the other way is the plant is enclosed in a small muslin bag, and it is suspended in the jar at a height, and it will just be covered by the liquid. So you can take the example of the tea bags. In the tea bags, the tea leaves, they are closed in a muslin bag. Or what is muslin? Muslin is a soft fabric, or soft, you can say, lightweight cotton cloth. Or so you can take this example of tea bag, and tea bags are, in the tea bags, the tea leaves are enclosed, and what is done, these tea bags, they are suspended in the boiling water. You can take boiling water in a cup, and you can put the tea bag in it, and obviously the active constituents from the tea bag, from the tea leaves which are contained in the tea bag, they will diffuse into the water, and tea is made. So there are two methods. Basically, you can use a teapot having a perforated tray on which the crude drug is placed, and then water will be poured on it. And the other method is you can enclose the crude drug in a small muslin bag, and you can suspend it in the jar at a height, and then it will be covered by the liquid. Fresh infusion. Now, it is prepared with the drug and the menstruum, and it would be used before 12 hours. For example, infusion of kosher and infusion of senna. So, fresh infusion should be used within 12 hours, and infusion of kosher and infusion of senna are the examples of it. So what is senna? Senna leaves are basically used as a laxative to treat constipation. Concentrated infusion, it is prepared by double or triple maceration processes. So, concentrated infusion, is prepared by these two methods, and these two methods we're going to discuss in the upcoming slides. So here I would say that double maceration is a process in which the menstruum is divided into two equal parts and then extraction is done. And in triple maceration, the menstruum is divided into three equal parts and maceration is done. So this concentrated infusion, it is 8 times stronger than the fresh infusion, and alcohol is used in the concentration of 20 to 25% as a menstruum. And this preparation, this concentrated infusion, it can be stored for a longer time as compared to the fresh infusion, because fresh infusion, it should be and it must be used within 12 hours, not after 12 hours. The dilution, how can you prepare diluted infusion? By taking 1 ml of concentrated infusion and mixing it with 7 ml of the water, and it will correspond to the fresh infusion in potency. Potency means in activity. For example, concentrated compound infusion of chirata and gentian, these are the examples of concentrated infusion. And drugs used in the process of infusion, they are thermolabile, which means they are heat sensitive and they are soft in nature. What is concentrated compound infusion of chirata? It is a bitter tonic and it is used in dyspepsia, scanty urine, which is oliguria, in which the frequency of the urination is less, epilepsy, which is a neurological disorder, and concentrated compound gentian infusion. Gentian means violet. It is used in medicine for 100 years. It is antiseptic and it is used externally. Topically, it is used as an antibiotic and it is also used as an antifungal agent topically. It is used as an enthelmintic by oral administration. Enthelmintic means for the removal of the worms from the body. It is used, but it is in that case it is used orally. Concentrated infusion of chirata. So what is the method of concentrated infusion of kasha? What is the method of preparation and what are the ingredients? Kasha 80 gram, alcohol 250 ml, and the concentration of alcohol will be 90%, which means 90 ml of alcohol and the remaining 10 ml of the water. So 90% of alcohol and 250 ml and distilled water and cold water of quantity sufficient to make the 1000 ml. What is the method? It is prepared by triple maceration method, which means the menstruum will be divided into three equal parts. Kasha, it is macerated with 650 ml of cold water for 1 hour, and during that 1 hour, it is mixed occasionally. Then it is strained, and then the liquid is reserved. Then repeat the maceration process twice using 500 ml of cold water for each maceration, and combine the second and third maceration and evaporate to 100 ml. Then mix the third liquid with the first liquid and add alcohol and adjust the volume to 1000 ml with cold distilled water. Dose is 2 to 4 ml, and it should be noted that alcohol is added to the final product as a preservative. What are the uses of a concentrated infusion of kasha? It is used as an antimalarial and it is also used as a appetite stimulant. Those patients who do not feel hunger and who do not feel appetite to eat something, so for those patients it is recommended. Dilute infusion of kasha. It consists of concentrated infusion of kasha 125 ml and distilled water, which is quantity sufficient 1000 ml. What is the preparation? Take 125 ml of the concentrated infusion of kasha and mix it with distilled water to make the desired volume, and dose is 15 to 30 ml. Diluted compound infusion of gentian. Gentian thinly sliced 12.5 gram, dried bitter or orange peel, which is cut into small pieces 12.5 gram, dried lemon peel, which is cut into small pieces, that is 12.5 gram, and boiling water quantity sufficient to make 1000 gram. Preparation: macerate the solid drug with 100 gram of boiling water, then strain it. Dose is 15 to 30 ml. Gentian is bitter tonic and is used to stimulate gastric secretions. It strengthens the digestive system and improves the appetite. So patients who have a weak digestive system, their digestive system will be strengthened by using this dilute compound infusion of gentian. It should be used 30 minutes before or 60 minutes before a meal with the glass of juice. Decoction. Solutions of water-soluble constituents of plant drugs, they are prepared with the boiling water and drug. And in this, what is the difference between decoction and infusion? In infusion, soft part parts of the plants are used, but in decoction, hard woody parts are used. So hard woody parts are used, and in infusion, cold water was used or warm water will be used, but in decoction, only boiling water will be used. So how a decoction is prepared? Then you have to chop off the drug into small pieces, 5 parts, and then it is boiled with the water, which is 100 to 120 parts, in a vessel which is layered with iron or earthenware for a definite time of 15 minutes. So when will you start counting the time? Once the water starts boiling and you can see the bubbles of the boiling water, at that time you will start counting the time, which is 15 minutes. So you have to stir it as well during this process. To obtain the highly concentrated decoction, boiling is continued until the liquid is reduced to a certain volume. So you have to, if you want to get a very concentrated decoction, then you have to keep boiling it until you get until the liquid evaporates and you get a concentrated volume of the preparation. You have to allow it to cool and to about 4 degrees centigrade. The mark is pressed and the mix the resulting liquid to the decoction. So it is the process of preparing it. At the end of the decoction time, decoction is strained through the fine muslin or phenolane according to the nature of the mark. So what is muslin? As I told you earlier, it is a lightweight cotton cloth, and phenolane, it is a soft fiber fabric of different fineness. So you can use any one of them depending on the nature of the mark. Sufficient water is passed through the strainer to produce a definite volume. What are the examples of decoction? Cinchona bark or wood which contains quinine. So basically quinine is an active constituent which we get from the cinchona bark, and this quinine, it has antimalarial properties, so it will be used for the treatment of malaria. So and it is used for the treatment of fever and as an appetite stimulant. So it is also used in anemia, which is iron deficiency, indigestion, gastrointestinal disorders, and general fatigue. And there is no official decoction mentioned in Indian pharmacopoeia or British pharmacopoeia. So comparison of infusion and decoction, as we can see here that the soft parts of the plants, they are used in infusion, whereas hard woody parts are used in a decoction. Menstruum is used maybe cold water or boiling water, but in decoction only boiling water is preferred and only boiling water is used specifically. What is the procedure of infusion? They infuses the drug with the cold or hot water, and you have to or whereas in decoction boiling the water with the boiling the drug with the water. What is the time? Time is calculated as soon as the water is added to drug. This is how time is calculated in infusion, whereas in decoction the time is calculated when the water begins to boil. Adjustment of final volume, no adjustment is required in case of infusion, but in case of decoction, adjustment of the final volume, it is very much necessary. Apparatus used for the infusion is earthenware pot, and apparatus used for decoction is any covered apparatus which has a lid or which has a stopper on it. Storage date in the infusion, it should be stored for 12 hours, and fresh infusion it must be used within 12 hours, and you can store concentrated infusion for a little longer period of time. Whereas in decoction, it should be used fresh, and when stored, it should be refrigerated for a few days. Why refrigerated? Because by the process of refrigeration, the temperature is less in the refrigerator, and it will be it's stored on the lesser temperature for some days. Digestion is a process which could be called as modified maceration, in which the extraction of drug is carried out at a very high temperature, but that high temperature, it does not affect the active ingredients negatively. How? For example, in a rotary evaporator, when we use it to concentrate a certain drug material which is dissolved in a certain menstruum, so we always take care to not to exceed the temperature than 40 degrees centigrade, because the active constituents contained in that preparation, they will be destroyed if we increase the temperature more than 40 degrees centigrade. So similarly in digestion, if we increase the temperature, it does not have any negative effect on the active constituents. So use of the high temperature, what benefit does it provide? The major benefit is that it provides a very wide solvent action of the menstruum, and it helps in the extraction of almost all of the ingredients. So this is the major benefit. If menstruum is volatilized at the temperature employed, a reflex condenser is attached to the vessel so that the solvent may be get condensed, and then it will be